More Americans are spending money for complementary health therapies like acupuncture, meditation, and supplements. News Channel 5's medical expert Dr. David Soria is joining us now to explain why we're spending so much money on these things. You know, 10 or 15 years ago, I tried to do a couple of stories on these with mainstream doctors, and I was laughed at. Just don't even touch it. I will not treat a patient who's doing a complementary medication or therapy to supplement it. So what changed, or did nothing change? Just more of us are using these medicines.
Well, clearly it's a huge industry. I mean, we're talking about billions of dollars being spent. 30% of all adults are using it. 12% of kids use alternative therapies or complementary therapies. And why is that? Well, I think it's primarily mostly second to great marketing, because there is absolutely no more scientific data that shows these things work any better than they did 10 or 20 years ago.
Do you recommend any of them?
You know, I do, and I'm not based on science, based on things that are very simple, meaning if it makes you feel better, I recommend it. Look, I don't swear by conventional medicine. I don't think we have the cure or the answer to every pathology or to every ailment. So if you go to an alternative, if you go and get acupuncture, if you go get a manipulation from a chiropractor, if you take a supplement over the counter and you tell me it works, whether I believe it's placebo or not, the fact of the matter, it's making you better, whether that's psychological or whether it's physical, then in fact it helps. So I'm all about that. Look, I take supplements myself. Is there proof behind it? No, but I feel better. I think it makes me feel better.
We've got to wrap because of all the breaking news today, but I suppose today doctors are a little more willing to at least talk to patients about alternative therapies and supplements, things like that.
Without question, because they're so popular. But there's three things to be aware of, and that is that they're very expensive.
Very quickly.
And you bet. And there could be side effects, but most importantly, they can have interactions with your medicine, so make sure you check with your doctor.
Bottom line, talk to your doctor.
No
Thank
question.
you so much.
You bet.